What age groups would you define as having these sleep apneas, or based on weight, age, or as well as the work area? Is it all just based on a certain aspect, or do you just see a wide range of people with all kinds of symptoms?
We see a very wide range. We've had people in their 90s, and we've had the youngest one we've had was less than 4. She was 3 something or other, and she had fairly significant sleep apnea. The youngest one we've had, but we have them all in between. Although the older you are and the heavier you are, and males have it a little more often than females, so the risk increases again by being older and heavier and male.
And your hours of operation?
Well, we have a night schedule and that's based upon our tech's schedule. So we are usually scheduled 4 to 5 nights per week to do the sleep studies, and I see consults on Tuesday, Wednesdays, and Thursdays, and usually from about 11 to 1 or 2, depending on, and I make special arrangements for some people. Occasionally people who have special needs for their job or school or whatever, I can come in at other times and meet them and do their consults. We try to accommodate the patients and, quote, be patient friendly.
So they'll need to have a referral from a physician, as well as then call in, to schedule an appointment, have the testing done for the diagnosis, and then come in for treatment as well. Once this treatment is performed, are there other days, more days that are required for them to get through this? Just a step-by-step and day-by-day process?
Right. After their treatment phase, their treatment night occurs, then they come in and I explain all the results to the patient and talk about the options for treatment. Most common of which is for sleep apnea is the CPAP. There's a dental option where the dental prosthesis advances the jaw and makes the airway slightly larger. And then there's a surgical option where other things are done, like removing the part of the soft palate, advancing the tongue through a surgical procedure, and the goal of all of that is to opening the airway. That's what obstructive sleep apnea is a collapse of your airway where it gets smaller and making it difficult to breathe, or number 2, it completely closing, which makes you unable to breathe while you're asleep, and therefore you have to arouse to a lighter level of sleep in order to breathe. The goal of the CPAP is to do that with air pressure, which opens the airway and keeps it open while
Are there
sleeping.
common steps that a person can take as far as getting better sleep? I know that you said the weight has something to do with it, but the age, I know you can't do anything about that. But as far as weight, I've read through your pamphlets that obesity that does have a part in this, but just other common areas that we could adjust ourselves to.
Really, the only other thing besides weight loss and controlling your weight is you're more likely to have the apneas when you're sleeping on your back. So sleeping on your side may reduce that. It doesn't for everybody, because some people have it worse on their sides, but most people have it worse on their backs when they're sleeping on their back.
Okay, so what are the consequences if someone goes untreated for the sleep apnea?
Okay, well, sleep apnea has been linked to many different diseases, and actually causes some things. Like, for instance, we know that a good number of people who have hypertension is caused by sleep apnea. It's a cause. It also enters into things like diabetes. You are more likely to have diabetes if you have sleep apnea. And the worse your sleep apnea is, the more likely to have diabetes you are. Also heart disease and stroke and actually recently there's been a link with cancer, and the more likely, the worse your sleep apnea is, the more likely to have cancer, and the less likely it is to respond to treatment. So we know that people who have sleep apnea die in car wrecks because they go to sleep, and you're much more likely to go to sleep if you have sleep apnea. Anybody who has daytime sleepiness is more likely to go to sleep and have a car wreck. But that's again the cardinal sign that you have sleep apnea. Is you have sleep apnea. I mean, you have daytime sleepiness in spite of you thinking you're getting enough time in bed. So. And you know, we all know people who have had heart attacks in their sleep, who die in their sleep, who have strokes in their sleep. That's not the only cause, but it's a big cause of people who die. And you're much more likely to die from all causes if you have sleep apnea. So it's a pretty big deal, and obviously the worse your sleep apnea is, the more likely to have all of those things.
So certainly be aware of your symptoms. If you have any other questions, just to give them a call at 601-849-5277, or also visit their website at www.mghosp.com. And we certainly appreciate the time that you have taken for this interview. Any problems that you may have with the sleeping, make sure you visit your physician, see what he has to say, and if you do have sleep apnea and he does give a referral to Dr. Runnels, this is the man that'll help you.